Welcome to the Endocrine Matters podcast. This podcast episode is sponsored by Complete Medicine and Hey Healthy. Welcome back to Endocrine Matters. I'm your host, Dr. Arti Thangudu, and today we're diving into one of the most important topics in modern medicine, understanding the difference between direct care and concierge medicine. We'll talk about why price transparency matters, how to get the best value for your healthcare dollar, and why understanding the actual cost of your care can completely transform how you engage with the system. If you have ever looked at a medical bill and thought, how is this even possible? This episode is for you. Our current healthcare system is, frankly, a mess, confusing, expensive, and full of hidden costs. Patients rarely know what anything costs until after they've already received care. Even as physicians, we can't tell our patients how much a lab test or imaging study will cost using their insurance because it depends on contracts and billing codes, and no one can understand this or easily access it. Hospitals and insurance companies have made things intentionally opaque, and the people who suffer the most from that are patients. It's hard to make good healthcare decisions for yourself or your family when you don't know what you're paying for or why. That's why models like concierge medicine and direct care are gaining so much momentum. So, what are these models of care? Most people are skeptical of healthcare outside of their insurance, and insurance companies want it to be that way because it gives them power over doctors and patients. But let's dig in to describe what these models really are and why they are worth at least considering. Let's start with concierge medicine. In concierge medicine, patients pay an annual or monthly retainer for enhanced access, things like same-day appointments, longer visits, and direct communication with your doctor. However, most concierge practices still bill insurance. The membership fee is in addition to what your insurance is billed for visits, labs, and procedures. It's a great model for people who value close access to their physician and don't mind the dual-layer cost structure, but it can be pricey and unpredictable depending on how your insurance covers costs. Now, let's talk about direct care. It's a model that completely changes the game. This is the model of care in my clinic, Complete Medicine. In direct care, whether it's primary or specialty care, patients pay a flat monthly fee or per visit fee directly to the physician. There's no insurance billing at all. That means no middlemen, no surprise bills, no prior authorizations dictating your care from your physician. Everything is transparent. You know exactly what you'll pay before your visit, and physicians can often provide negotiated cash prices for labs, medications, and imaging, often 50 to 90% lower than insurance-based rates. For example, I might send a patient for an ultrasound that costs $100 through our negotiated pricing. The same test might be $800 or more through insurance at a hospital. Once my husband was hospitalized for an appendectomy, the hospital billed his insurance $2,000 for a CMP, which is a simple blood test that I get for my patients in my office for less than $10. This is how egregious price gouging is in healthcare. In direct care, your doctor is not controlled by that system and is simply there to serve you. That's the beauty of direct care: clarity, control, and value. So what's the real difference between direct care and concierge medicine? One, insurance involvement. Concierge practices bill insurance and charge a retainer. Direct care doesn't bill insurance at all. Pricing. Concierge care is often more expensive and less predictable. Direct care is clear and fixed. Transparency. Direct care gives you upfront pricing. Concierge care typically doesn't. Value. Both emphasize personalized care, but direct care often delivers the highest value for your dollar. Neither is better in every situation. They're just different models serving different priorities. But if you're someone who values transparency and affordability, direct care is usually the better fit. Transparency is the foundation of trust in healthcare, and we have destroyed that in the traditional system. When patients know what things cost, they can make informed choices, they can budget for their health, and avoid financial surprises that lead to stress or medical debt. For physicians, transparency frees us from the administrative burden of coding and billing so we can focus on what matters most: patients and patient care. This model also creates opportunities for price negotiation. Because we're paying cash directly to labs, pharmacies, and imaging centers, we can often secure fair discounted rates that actually make sense. Now, here's something that not enough people know about. Direct care pairs beautifully with cost-share programs. Cost-share programs like Sedera, which I personally use and recommend to many of my patients, are designed to protect you financially in the event of a catastrophic event such as a hospitalization, surgery, or serious illness. They work differently from insurance. Instead of paying a high monthly premium, you pay a much lower monthly contribution, and the community shares large, unexpected medical expenses. When you combine direct care with the cost share program, you're covering both everyday predictable healthcare needs and protecting yourself against major unexpected costs, all while keeping your monthly expenses dramatically lower than traditional insurance. It's a smart, empowering way to reclaim control over both your care and your costs. Many employers choose to self-fund their employees' health insurance, which is a similar concept. Employee premiums go to the community pool and claims are paid out from this pool. Self-funding marries well with direct care and direct contracting to keep employees well, happy, and out of the hospital. This is what our company, Hey Healthy, does with companies. Here's some practical advice I always share with my patients and that I follow myself. Always ask for the cash price on labs, imaging, and medications. It's often much lower than what insurance will bill you. Amazon Pharmacy, Mark Cuban, Cost Plus, and GoodRx are good resources to learn cash prices for meds. We'll link them in the show notes. Choose independent imaging centers, not ones owned by hospitals. You can save hundreds, sometimes thousands of dollars on MRIs, CT scans, and ultrasounds just by going to an independent facility. Use transparency tools like cms.gov to see what Medicare pays for specific services. That gives you a baseline for what's reasonable. Medicare does often underpay for certain services, so you should expect to pay 150% of Medicare. But if the cost of a service is much more than that, negotiate. You can negotiate your healthcare bills, and you should make this routine practice. Start with asking for an itemized bill and look up the cost of the services you are billed for. When you start asking questions and comparing prices, you'll be amazed at how much control you actually have. Now, let's talk about why staying out of the hospital is key. Of course, go in the case of emergency. But there are many issues that go to the ER because of lack of access to a primary care doctor or specialist, which, as we discussed, concierge medicine and direct care practices tackle. Here's the reality. Once you end up in the emergency room or hospital, you lose control over costs. Prices there are completely unpredictable, and even with insurance, bills can be staggering. That's why proactive relationship-based care like direct care or concierge medicine is so important. By focusing on prevention and early intervention, we keep you healthy and out of the hospital. The best thing you can do for your health and your wallet is to invest in consistent preventive care that keeps you well. So to wrap up, both concierge medicine and direct care models offer patients something the traditional system doesn't: time, access, and humanity. If you're looking for the highest value, true price transparency, and control over your care, direct care, especially when paired with a cost share program like Sedera, can be an incredible choice. And remember, ask questions, know your coverage, and take the time to understand your healthcare costs, because knowledge is power and empowered patients make better, more confident decisions. Thanks for joining me on Endocrine Matters. I'm Dr. Arti Thangudu, reminding you that great care starts with understanding, and transparency is the foundation of trust in healthcare. Until next time, take care of yourself and stay well. If you'd like to make an appointment with us or learn more about our clinic, you can find us at essaycomplete.com or follow me on Instagram at Dr. Arti Thangudu, just my name.